Hey, good afternoon or morning, depending on when you're watching this. My name is Roberto Salazar. I'm a student here at Charles Archer University, and today I'm going to be going into a project that I had a lot of fun doing, and we're going to be talking about adequate cardiac monitoring. So, just some quick background on my project. So, this interests me a lot because here in the United States, we do have an increased risk of heart disease due to people becoming increasingly overweight. And so there was an alarming number that I saw when I was researching this topic, and that is that here in Los Angeles County, of the people that do have heart disease, 40% of those people will die of their complications. So that was a very alarming number. And it can be credited to Los Angeles just having a very diverse population, and this population is susceptible to have heart abnormalities. This is due to their poor diet, their lack of exercise, and underlying health conditions. Here in Los Angeles County, the majority is Hispanic and or Black, and this is the population that is most susceptible to these diseases. So, what is the significance of this problem? Well, here in the hospital that I was working or doing my preceptorship at, we found that uh, telemetry boxes are being lost almost every day, and it's not an individual unit that has this issue. I was lucky enough to be at a hospital that I work at, and it was very easy for me with my preceptor, of course, with the permission of my preceptor, to go to different floors and see their statistics and the issues that they have going on. And so across the board, I found that telemetry boxes being lost is not individual to a specific floor. So telemetry has this issue, DOU has this issue, and ortho has this issue. So this is the reason why I picked this project, was because it's something that can be addressed. So through my research, I found that from January to May, in total, there was 18 telemetry boxes being either lost or misplaced. And so what I mean by lost or misplaced is that misplaced meaning that the nurse accidentally throws in dirty linen and EVS finds it later on in the laundry chute, or sometimes they accidentally throw it out with a dirty chuck and they just don't realize they throw it in the trash. And in very rare occasions, patients have gone home with the telemetry boxes, and we need to call the patient to bring that back immediately. So, what are the consequences of not having these telemetry boxes? Well, there's a limited number of devices, often leads to a lack of cardiac monitoring, which negatively affects health outcomes and patient care. Additionally, the loss of these devices also limits the number of beds available for admission and cardiac related diagnosis. So I can't speak to any other hospital specifically to their policy, but at the hospital where I was at, if a patient has some type of cardiac abnormality and the physician orders an order for cardiac monitoring, they cannot be admitted to the hospital. Although there may be beds available, they cannot be admitted to the hospital if there isn't a telemetry box to monitor them during their stay. So if we don't have any telemetry boxes because they're being lost or misplaced, that makes it a lot more difficult to care for these patients. Sorry, just pulling up my notes. Okay, so pretty much during this project, I decided to go ahead and look at the root cause. These boxes aren't just being lost or misplaced just randomly. We need to see why this is happening. So one of those issues was accessibility. It's very easy for a nurse to go to the clerk and just grab it from the drawer. Hey, the box isn't working in room 10. I'm gonna go ahead and change it. You go in the room to change it, you disconnect the wires, you go ahead and connect it, you leave the box in the room. Now there's two boxes being occupied in the same room, although not both of them are being used. Another issue is that it's very easy to uh, commonly just misplace them. Like, hey, I'm gonna grab it, I'm gonna put it on top of the nursing station. Well, nobody knows if it's clean or dirty. Nobody knows if it works or not. So it's just being left out there. Um, that can be knocked down. It can be taken, and just having accessibility, that extra accessibility, actually, funny enough, makes it more susceptible for it to be lost or misplaced. One of the other things was inappropriate use. There may be patients that met the criteria to be on telemetry monitoring when they were admitted to the hospital or when they showed up to the emergency room, but the physician didn't reassess the need, and now they just have a telemetry monitor without having to need one. Another thing is that sometimes the physician may reassess and say, okay, well, they don't need it anymore, but they never put in the order. So we need to continue the monitoring while that order is in place. And another thing was it was just simply a lack of accountability. Nobody can take responsibility for the telemetry boxes. It's nobody's responsibility pretty much at the stage where when I joined for the preceptorship, there was no accountability for these telemetry boxes. It was kind of all their loss. There was really no one to blame. It was nobody's responsibility to really keep account for it. So it was interesting enough. I went ahead and did my own research on the financial implications. But this goes to the financial implication. It goes way. It's not as important as the care that the patients are suffering from. But it was just interesting to see the numbers play out. So the IntelliVue MX40 is a wearable patient cardiac monitor, and the cost to replace one of these was total to be about $5,000. If you want to put that into perspective, a new graduate nurse at this hospital usually makes about 45 an hour minimum. So after taxes, it actually amounts to the same amount. So when you're losing these telemetry monitors that cost $5,000, you're actually taking money from your own unit that could have been used for resources and um, an array of different things that could have been available if we were just more careful with the things that we have. So the cardiac monitoring business is booming. So it raised from 4.7 billion to 31.67. It's expected to exceed that number of 31.67 billion. The cost of telemetry monitoring in a non-ICU setting, so that'd be the floors that I was talking about earlier. Non-ICU settings are averaged to be about $41,690 for 379 telemetry days. For more recent estimates post the cost at about $1,400 per patient per 24 hours of telemetry. So uh, if a patient does not need the telemetry monitoring, this is money that's being charged to the insurance company or to the patient in general. So after collecting all this data and really looking into the consequences and everything that has to do with telemetry monitoring, I came up with a question in regards to this project. In cardiac patients with the need of telemetry monitoring, how constructive is the availability of telemetry monitoring compared to misplacement in accordance with the provider's plan of care? So to answer this question, we obviously had to do a ton of research. So we're gonna go into the review of literature. The database I used was Google Scholar and PubMed. These two were the only ones I feel that I needed. They were perfect. They had a lot of resources. And thanks to the CDU library, I had access to a lot of these articles. So some of the key terms that I used to find these articles were telemetry monitoring, importance of telemetry monitoring, proper use of telemetry monitoring, and stroke and telemetry monitoring. Um, so just from the literature review, I found that there was a strong correlation of early diagnosis with the aid of telemetry monitoring. There's a ton of research on that we'll get on into in a bit. And the research available focused more on the overuse of telemetry boxes rather than their benefit. So I found that the remote surveillance of patients in hospital settings have been said to be successful intervention in terms of patient care and safety. So continuous form monitoring enables providers to respond to a deterioration patient early, which results in better health outcomes, reduce mortality rate and heart failure hospitalizations, and coronary artery disease is one of the leading causes of death in ventricular arrhythmias. Are common arrhythmias associated with sudden death. So having a telemetry monitor on a patient like that actually improves their chance of survival. So, as we discussed before, patients that made it continuous cardiac monitoring have shown to have reduced mortality rates. And the idea of optimizing the use of telemetry monitoring is not intended to reduce the telemetry use. So, although we are saying that maybe some patients don't need telemetry monitoring and there's research to back that up, it doesn't mean that we need to stray away from the use of it altogether. We're just saying that there needs to be a constant assessment of the need of the telemetry boxes. So if there's another patient that does need it, taking it away from the patient that don't need it, it just makes it available. It makes the whole flow of the hospital a lot better. You won't be backed up in the ER. Your floor won't be as crazy to try to get telemetry box on patients. One of the things that I found interesting that defibrillations are associated with survival rates of up to 75%, with decrease in chance of survival for every minute that defibrillation is delayed. So the use of cardiac monitoring has supported survival in non-critical and critical care units. So it's a crucial factor associated with survival. The mortality of patients with acute myocardial infarction has been greatly reduced with the use of these cardiac monitors. Telemetry monitoring is not only used for monitoring devices, providing communication between healthcare professionals as a diagnostic tool. The monitoring is also seen as a tool to prevent negative healthcare outcomes. The prevention of negative health outcomes that arise due to adequate use of telemetry monitoring in the hospital setting is expanded to include diagnosis of complex arrhythmias, a cure myocardial ischemia, and pharmacologically induced prolonged QT intervals. The monitoring of patients also has the ability to determine acuity and accelerate protocols of admissions for high-risk patients. When a patient is already admitted and goes for procedures like, for example, in cardiac surgery, cardiac monitoring allows for the monitoring of arrhythmias that can arise due to it being more risk for ventricular tachycardia, AV blocked after surgery. Ultimately, the use of these monitors are what improve healthcare outcomes and was adequately determine acuity for patients who may require a higher level of care. So some of the recommended best practice that I found through my research was that physicians' medical assessment and determination of telemetry need. This is the theory that, this is a theory that this in theory would decrease inappropriate use of telemetry that telemetry boxes that usually lead to lack of telemetry beds, including telemetry monitors. While determining criteria for high-risk patients, this will allocate telemetry monitoring based on urgent need. So it's very difficult to try to implement something like this hospital-wide. So what I decided to do with my preceptor was to try it out on one floor and see what the response is. And so some of the policy and protocol for practical change was that this new policy and protocol are that the nurses must sign in and out the monitor box. So if a patient is admitted and he needs a telemetry box, well, you're gonna have to sign it out. That's the nurse, as if you're admitting somebody. When telemetry box is discontinued or becomes faulty, or the patient is discharged from the floor, the nurse must return the box with the cosigner. There's been talks of disciplinary action, but we didn't really expand on it. It was just an idea that was being thrown around. And then monitors have been given an identification sticker that coincides with the room. It's one of the simplest interventions, but I think it's would be the most effective if you just put a sticker that says, hey, this telemetry box is only for the patient in 4005. And so it keeps everyone accountable of this telemetry box and from where it is. So the way we plan to evaluate is that the biomedical engineering department will take inventory of the telemetry boxes each day to ensure that all monitors are accounted for. Staff will be updated on the performance during huddles and quarterly meetings. And with this implementation, we expect that there will be a decreased loss of telemetry monitors. So a lot of my classmates didn't really get to see their project through. Luckily, I did. So from June to August, there were no telemetry boxes that have been lost. And I think this is in due to part of the shared responsibility that everyone has to keep into account where the telemetry box is. And it's easy to account for everything that's there because of a sticker. You know what room this belongs to, what patient it belongs to, and when the patient is discharged, it's very easy. Well, did this patient have a box? If they did, where is it? And then these are my references. I appreciate you guys for your time. Thank you.